What to review weekly for every skilled resident. A weekly skilled review can make the MDS workflow much easier to manage, not because it removes the work, but because it gives you a routine way to see what needs attention before it becomes urgent. For every skilled resident, I would start with the basics. Who is currently skilled? What are they skilled for? What assessment is open? What is the ARD? What dates are coming up? And what needs follow-up this week? The first thing to review is the MDS schedule. Look at open assessments, upcoming ARDs, completion status, and anything that may need coding review. This helps prevent the assessment from sneaking up on you. The second thing to review is Medicare certification tracking. Cert dates are easy to miss when they're not part of the same workflow as your skilled review. If your facility expects MDS to help monitor certification timing, those dates should be visible every week. The third thing to review is the skilled reason. Ask yourself, is the resident still receiving skilled services? Is the skilled need clear? Does the documentation support why the resident remains skilled? Has anything changed since last week? This is not about questioning every stay. It is about staying aware of the clinical picture. The fourth thing to review is therapy documentation. If therapy is involved, look for updates that affect the skilled picture. Are the disciplines still treating? Are there progress notes or updates? Is the documentation consistent with the resident's goals and current status? Are there changes that affect discharge planning? The fifth thing to review is skilled nursing documentation. For residents skilled under nursing services, the chart should clearly show the services being provided. That may include wound care, IV medication, respiratory services, complex clinical monitoring, teaching, or another skilled need depending on the resident. The sixth thing to review is section GG follow-up. Do you have the information you need? Do therapy, nursing, CNA documentation, interviews, and observations line up? Are there conflicts that need clarification? Waiting until the last minute to resolve GG questions can make the assessment feel much more stressful. The seventh thing to review is discharge planning. Is the resident expected to discharge soon? Has the plan changed? Is there a planned discharge date? Does the team need to prepare for a discharge assessment or GG discharge items? Even if MDS does not own discharge planning alone, discharge timing affects the MDS workflow. The eighth thing to review is triple check readiness. This does not mean you are doing a full triple check every week. It means you are watching for items that could become triple check issues. Is the assessment on track? Is the ARD correct? Is the certification status clear? Are there payer or billing concerns? Is the skilled documentation organized enough for review? A weekly skilled review does not have to be complicated. The goal is to create a consistent rhythm. Look at the resident, look at the dates, look at the open assessments, look at the documentation, look at the certs, look at the discharge plan, look at anything that needs follow-up before triple check. When you do that every week, skilled MDS becomes less reactive. You are not waiting for problems to appear at the meeting. You are building a process that helps you notice them earlier. That is the value of weekly skilled tracking. It gives you one place to return to, one routine to follow, and one clearer view of what needs attention for each skilled resident. If you're looking for tools and resources to aid you on your MDS journey, check out our shop at 5starmdsnavigator.gumroad.com or come see us on Etsy at 5 Star Navigator.